Now, for conditions like depression, it always seems like the best approach is the combination of antidepressants, antipsychotics, and some kind of non-pharmacological therapy. Is
Mhm.
that does that ring true for schizophrenia as well? Is that non-pharmacological therapy also just as important as the medication side of it?
It can be, yes. So, number one, it's another touch point. It's another clinician who has an opportunity to evaluate them on some sort of a regular basis and monitor for any signs of relapse of symptoms, and then can maybe get word to that to their prescriber or whomever. So it's a touch point. Uh, to especially early in the disease process, early in diagnosis, therapy can be very beneficial to help build that insight, do a lot of psychoeducation about the risk of relapse, why it's important to delay time to relapse or reduce that risk for relapse, depending on which label you're talking about in the study that was done. Um, you know, explaining that with every relapse they literally lose brain tissue, which is why they kind of never get back to where they were prior to that very first psychotic episode, and they can only ever be as well as they were prior to the next episode. And so we want to minimize the number of episodes across a lifetime. If a psychotherapist is willing and able to work with the family, it can help to provide that psychoeducation for the family as well. Help them understand what the disease process looks like, what they can expect over time, how to have the best outcomes, how to best support their loved one that's suffering from this illness, and things like that, and can really help to build strong networks. I unfortunately tell people all the time, my people with schizophrenia, and I never say schizophrenic because that's like saying, I'm high blood pressure, right? I'm not high blood pressure. I might be a person with high blood pressure, but I am not high blood pressure. So I always say a person with schizophrenia, um, you know, when they're in their 40s and 50s and 60s, they're coming to their appointments alone or with case managers. They almost never still have family supports in place. Almost never. It is extremely rare if I have a patient with schizophrenia that's talking to me about a family relationship. And that's very unfortunate, but it's because over the years with multiple relapses, the families just, I don't know what to do with this family member. I'm throwing my hands up. I'm done. I can't take anymore. This is exhausting. This is affecting me and my mental health. And I'm just, I'm not doing it anymore. And by the time they've had a number of relapses early in the diagnosis time frame, early in those first 5 to 10 years, they burn tons of bridges